Yeah, this study was a very interesting study that was designed and completed by our staff scientist, Dr. Ajit Vemuri. The idea was to look at the level, meaning the intensity and also the duration of the physical activity and its association with mental health among stroke survivors. We know that physical activity is the best or one of the best strategy to prevent a secondary stroke, and also it has a relationship with the mental health. It was shown previously that physical activity can improve mental health in general population, and in this study, our goal was to investigate this association among the stroke survivors. So what we did, we used again the same CDC database from 2011 to 2019, and we studied the level of physical activity among the stroke survivors who participate in the CDC survey. What we found was that stroke survivors that they had the physical activity level according to what guideline recommended had in average 3 less days of poor mental health compared to stroke survivors who did not do the recommended level of physical activity. What we found in this population was a relative difference of 43 to 53%. Depends on in different ages and sexes and also different socioeconomic level. Patients that they were younger and also they were from a higher socioeconomic status, they benefited most from the physical activity. And the last part of this study that was triggering was to find the optimal dose of physical activity among stroke survivors with respect to the mental health. And what we found is that 4 to 6 weekly of moderate physical activity is probably the best dose to have the best mental health outcome among stroke survivors.